Happy Hump Day, folks. Thanks for joining us here for Wake Up Charlotte to Go. I'm Ben Thompson. Sarah French is joining us. And then this morning, we've got Dr. Katie Passaretti. She is the Director of Infection Prevention over at Atrium Health. A big job, especially a big job over the last a year and a half. We appreciate her taking time this morning to answer some questions that all of us have. Which, speaking of, go ahead and submit any questions you might have. We're talking specifically about COVID booster shots. So if there's any questions, you now at this moment have a really qualified, super scientific person at your disposal. So now's a great time to go ahead and ask any questions that you have in the next few minutes. Doc, thanks again for coming on. We appreciate it. Go ahead and bring us up to date. Where do we stand with booster shots? Because I do think there's some confusion. I know Pfizer is now available, but remind us, who can actually get it? Because I hear everybody's getting it right now. Who can get it? Who can't? Are those actually enforced? Those rules? What's the deal?
Yeah, so I think first it's important. There's been some confusion about the difference between third dose for immunocompromised individuals and boosters for other high-risk groups. So just to kind of clarify that first, third dose for immunocompromised is an additional dose. You can get that either for Pfizer or Moderna, and that creates confusion in the booster discussion as early as 28 days after the second dose. And that's because people with weaker immune systems don't respond as much to any type of vaccine, to try to get them just at the same level of protection that, people with a quote unquote normal immune system have with just 2 doses. So just to kind of clarify that difference, boosters, and it's still a quote unquote third dose. It's still the same dose. It's still the same vaccine, are intended for people that got that full immunity initially, but it's kind of petered out a little bit over time to boost it back up and make sure you're protected. So who are approved for that? As you said, Pfizer only right now. Anticipate that Moderna, J&J will submit information over the coming weeks, but not quite yet. So anyone that got vaccinated with Pfizer at least 6 months ago, so completed that series, who meets high-risk criteria. And what those have been defined by for both FDA and CDC are 65 and older, flat out. Anyone 18 to 64 with high-risk medical conditions, the people that end up, with more severe disease. And then finally, people that are at high risk for occupational or institutional exposure. So that might be healthcare workers, people that work in prisons, homeless shelters, where there's just a lot of kind of potential for exposure, to make sure those people can continue in the workforce.
So Joy is commenting right now. She wants to know when Moderna is going to come out with the booster shot. She says she has a compromised immune system. And I've heard a lot of people too wondering, okay, what if I do qualify? I'm ready for my booster, but I got J&J or Moderna. Can people mix vaccines or not?
Yeah, so the recommendation is not to mix vaccines unless it's kind of extenuating circumstances. You had a reaction to the first vaccine and need to switch categories, that kind of thing. So where possible, trying to complete the series. And we anticipate over the coming months that we'll get more data about mixing and matching different types of vaccines. That will be helpful in, potentially changing that recommendation in the future. But right now, what's been studied is the same dose. So when you go out of those parameters, predicting what happens becomes a little bit less clear. So hopefully we're getting closer to data on that. As far as Moderna and J&J, so J&J submitted in the past 24 or 48 hours information to the FDA for consideration of a booster. So that'll go through the same process we've seen multiple times. FDA review, CDC, ACIP review before approval, but hopefully in the coming weeks. And anticipation is Moderna will as well. And there's a lot of obviously interest, as your viewers have said, in moving that along. And, I think there's a lot of impetus at the FDA and CDC to make that happen as quickly as possible as well.
Melissa wanting to know what a lot of parents out there are wanting to know. And she says more concerned, the boosters aside, she's more concerned about when 5 and 11-year-olds can get their shots. What's the latest on that?
Yeah, and I do think that's a super good point. 5 to 11 we still have a lot of people that are completely unvaccinated, right? So boosters are like gravy, in my opinion, help people, but we still have people we need some sort of protection for. So, the 5 to 11 years old, the population that's not yet vaccinated is still super important to focus on. For the 5 to 11-year-olds, the FDA is going to review the data from Pfizer again, specifically on October 26th, and then it'll go. So I anticipate early to mid-November that if all looks good, it's safe, that will come out for 5 to 11-year-olds.
So say someone, they got both their vaccines or they got their Johnson & Johnson single dose vaccine and they aren't too worried. How important is it that people do get their booster shot? Should everyone be rushing out to get their booster shot as soon as they can?
Yeah, so the good thing is that the vaccines continue to be very, very protective against severe disease and death. And honestly, if I weren't a healthcare worker, I probably wouldn't have gotten the booster quite yet. I can, if taking me out of the workforce because of a cold weren't pretty impactful right now, then it doesn't. The people we're seeing that have been vaccinated that have post-vaccine infections have milder symptoms. The people that have post-vaccine infections that end up in the hospital are those groups, the older individuals, multiple medical problems. So if you're young and healthy, honestly, you probably don't need a booster right now. And it's important to focus on those who are highest risk.
Debbie has a great question, wanting to know, would she have a reaction to the booster if she didn't have a reaction to her first 2 shots?
So kind of that question could be interpreted 2 ways. So reaction as far as feeling sick after the booster, possibly. For me, my booster shot reaction was pretty much the same as my second shot. I felt crummy for 12, 18 hours, and then I was back to my normal self. As far as response to vaccine, that's a bit of an, whether you're the level of protection. Boosters very clearly increase your antibody levels and provide that higher level of protection, but there's some variability between individuals based on their immune response.
Since we've talked about kids and we've talked about reaction, just as a parent myself, I've wondered, for me with that second dose, it really hit me hard. I had to take a day off from work. So with our kids, should we expect the same? Should schools expect kids to be out once they're finally able to get their vaccine?
Yeah, so, I think if you ask about 50 to 60% of people, that second dose kicks a little bit more of a punch than the first dose did, as, you had, as I had. So I think always planning for the worst and being happy if it doesn't happen, that, the kid may feel a little crummy, have a little bit of fever and, I think children see that regularly with other types of vaccines, but that full anticipation, they bounce back quickly within 24 to 48 hours.
Doc, I'm going to ask you to be a bit of a sort of soothsayer and a bit of a fortune teller. You've been watching this now for the last year and a half. This is your deal. You've been watching the trends. Where do you see us at come the holiday season? Dr. Fauci got criticized this past weekend because he said, hey, we might have to wait and see what happens, around the holidays. But knowing how this has played out, knowing that we had the Delta variant, knowing that our numbers are now going down, knowing now that we have boosters, what's your best guess of what our holiday season looks like?
Yeah, I think it will be, in my opinion, better than it was last year. I anticipate we'll see, as we've seen every time there's group gatherings and, still partial kind of vaccination within the communities, that we'll see an uptick in cases. My belief is that it won't be as bad as it was. The thing I want to kind of have people remember is that, it's not just COVID. We focus very much on COVID, but as we head into November, December, nobody's wearing masks anymore, that kind of stuff. We had our first case of flu in my system last week. There's a lot of other respiratory viruses that I do worry about that could kind of add to the issue. So, making sure you're staying home when sick. If you're in those high-risk settings, likely going to still be important to wear that mask if you're in crowded indoor settings. And just thinking it through and planning ahead is important.
So Debbie's asking, how long will my booster shot last? It almost makes me wonder, is this going to be something like the flu shot where we are needing to get it every year?
Yeah, there are a number of vaccines where you get a booster and you're good for 5-10 years. There are vaccines like flu flu being another respiratory virus where the virus kind of changes over time where you need a vaccine every year. So, the unfortunate answer is, and this has come up like time and time again for the past, ever since the vaccines came, that we just don't know if it's going to become an annual. It's certainly a possibility. I think we hope that a booster will give you long-term duration, and with decreasing cases, we're good to go, but we just don't know.
All right, Dr. Katie Passaretti, we know you're busy, and we appreciate you taking time. And you know what? We don't say this enough, but I want to say this right here, right now, that people like yourself have been on the front lines of this thing for the last year and a half, working your butt off, missing your families, and I hope we all appreciate the expertise people like you bring to our community and bring to these conversations, because it's a real game changer. And I think you need to know everybody appreciates it profoundly.
Yes, so appreciated. Thank you so much.
Doctor, thank you. Thanks, everybody. We'll see you back here tomorrow.
Bye.